All right, so after reading chapter 4, um, I think that this specific chapter was very informative and very interesting. And I say that because of the fact that it talked about there's 9 principles and um, I guess it was just interesting to see all of the different principles that were in effect during COVID. So the first principle was the resources before restrictions. And something that it talks about is in here was this fact. So extended lockdowns hurt the poor the most. And this fact was clear early on during the COVID-19 pandemic and from early pandemics, like the 1918 influenza pandemic, the inability to work from home, lack of pay when absent from work, and self-employment were all associated with an inability to comply with public health mitigation recommendations. So then it also talks about in India that the prime minister abruptly ordered a lockdown of 1.38 billion people, which then leading to millions in poverty to struggle for food and thousands of migrant workers to start walking from urban centers to their ancestral villages with deaths along the way. So they were also restricting access to other medical care for prolonged periods led to higher rates of maternal and infant mortality in low and middle income countries worldwide. So I think this first principle kind of just it just kind of it will help the process a little bit more. So then the second principle was do more for those who need more. So in fall of 2022, the CDC issued guidance that widespread universal masking was no longer necessary. That was perceived by some in the United States as a deep betrayal of equity. The pandemic had taken a disproportionate toll on racial and ethnic minorities prior to the distribution and increased uptake of vaccines. So the perception here was that continued universal masking could address inequities. So I think something that could possibly come off of that was making sure that the socioeconomic determinants of health are equitable distributed, while requiring a commitment to combating poverty as well. So then it talks about the third and the fourth principles. The third principle was meeting people where they are. The fourth principle was debate and dialogue. Actually, the fourth principle was public health must be driven by data. And then the fifth principle was debate and dialogue, while the sixth principle was duty and sacrifice. The seventh principle was speaking truth to power. The eighth principle was specified interventions without judgment. It's also known as recommending interventions without judgment or undue enforcement. And then the ninth principle was public health does not know borders. And I think that one in specific was really interesting to read about, was because it talks about how all public health is both local and global, and how patents should not hold sway during a global public health emergency. So essentially, they tried closing the borders once different COVID-19 variants started to emerge, but that did not meaningfully prevent the transmission of infection. So in South Africa, whose public health system was the first to describe the Omicron variant, was rewarded for its careful work and transparent messaging with travel bans instituted by many Western countries, which very understandably upset African leaders. So I think that's something that's super important. And I think that's why the United States, when it came to traveling different borders, you had to take a COVID test before you got on the plane, before you got into the country, and then before you left the country. Because then if you got COVID while you're in the country, then that's not the United States. Then you would have to stay in the country until, like you were considered like not contagious. So then like the last principle was like harm reduction. And this kind of just like makes sense. It's just like when applied to like disease prevention, including like for infectious diseases. So like this principle was advising individuals how to mitigate risk while acknowledging the real world human desires of countries or conditions that may lead individuals to take some risks. So I just thought this chapter was just like very interesting and very informational.